So, as you all know, the immunization schedule has been developed and evolving over a number of years. And having been a pediatric infectious disease specialist for over 30 years, I've seen a number of new vaccines come on to the scene and become from a initially provisional recommendation to a full recommendation. And much of that has been driven around diseases that particularly affect children, but also that have long lasting implications for health into the adult world. So the immunization schedule has been developed and continues to evolve over time as new vaccines become available, new diseases come onto the forefront, and we need ways to prevent or mitigate their disease-causing properties. So I think the foundational change is really not that great because children and their healthcare givers, their parents, and the healthcare providers have always talked to families about the immunizations recommended by the American Academy of Pediatrics and formerly the ACIP as it existed. And they've discussed these vaccines with them. There are certainly vaccines that many of you knew as your foundational vaccines, and you, as young children, received those, and your peers received those, and they really took devastating diseases like meningitis and severe pneumonias and whooping cough and measles to very, very low numbers around the country. As vaccine hesitancy advanced, people chose to not immunize their children with any vaccines or only with some of these, and that has led for us to now be in the situation that we are in, experiencing pertussis, measles outbreaks. We've seen increasing cases of pneumococcal disease, which causes severe pneumonias or meningitis. And so, again, diseases that previously were at very, very low levels based on widespread vaccine use are now reemerging. So the new recommendations, which are well outlined on the CDC website with their updated recommendations. So we won't spend a lot of time unless you have specific questions about those, because they laid them out very clearly in the ones that were always the foundational group of vaccines, the diphtheria, tetanus, whooping cough, the pneumococcal vaccines, the measles, mumps, and rubella vaccines, the varicella vaccines. All of those foundational vaccines remain within the immunization recommended list. Some of the biggest changes that were brought forward with the newest recommendations moved some other vaccines into either risk-based and or shared decision making. And again, if we get back foundationally, all the pediatricians and all the family medicine physicians that care for children and discuss vaccines with families and with the caregivers of those children are always going through the reason why. Why do we do this? What is the benefit of receiving this vaccine? And thirdly, what are the side effects that you might expect from the vaccine? And this is where, we counsel people on those side effects. And it has always been a shared decision-making process. What we're doing now is discussing more around things like the respiratory syncytial virus, which is a injectable, but is a monoclonal antibody. So it's actually an antibody that someone is given that helps protect them for those first 6 months of life, or 6 months during the time that they're particularly vulnerable to getting an RSV vaccine, RSV infection, and a side effect from that infection. That those type of conversations families have been having with their healthcare providers. And so we know that uh, 100% of the children by age 3 will acquire respiratory syncytial virus. Children who get respiratory syncytial virus at an older age do better. They cope better with it. Their immune systems are better to respond to it. And they also have fewer complications and require less hospitalization as they're older. And that was the reason that this particular protection came out being offered in the first weeks of life. And certainly for those children that were born outside of RSV season, which is a very seasonal condition, are offered this when they're still in those younger infant days. So I think that the conversation with families around that continues to be much the same. We know that some of the other vaccines that moved to risk group or more of a shared decision making and risk stratification also are things that pediatricians, family medicine physicians, all are discussing with their parents about the risks that their child may have. Diseases like hepatitis A, which are transmitted basically orally, can be from a food source. Many of the outbreaks that you've seen have been related to certain food products, restaurants, shellfish, some of the other risk factors for hepatitis A, and certainly people who have well water who may not have good containment of their well water in terms of fecal contamination with the well water. All of these things are things that are discussed with families is what do you assess your risk for your child to be to acquire this particular hepatitis A infection. So again, looking at risk factors have always been a part of the conversation. I just think that it's now stratified a little bit differently. And when we look at new diseases emerging combined with vaccines, that allows us to counsel families better to say, if you are traveling to X area and you anticipate that you will potentially be exposed to this particular disease process, then this is a consideration for having your child immunized for that additional protection. The aspects of looking at evolution of disease processes is another big component of this. We know that there are outbreak situations like we are currently in the upstate of South Carolina that really are most rapidly and best controlled with widespread immunization against measles and making those counseling points available to families to say, this is what we would say to you if you were traveling to an area with an outbreak. Well, you live in an area with an outbreak. Let's get your child protected because, again, measles has significant comorbidities. It certainly causes hospitalization, can cause some very severe effects like encephalitis. And so trying to protect children from these diseases is the whole intent of immunizations and an immunization program. So Tammy, at this point, I'm happy to answer specific questions, things that I may have brought up or that we haven't addressed yet.
Dr. Lacroix, I guess this is a general question. One of the things that came up is when vaccines are no longer made mandatory, could that change what insurers pay for?
So I think that's always a concern. At this point in time, the communication that we've gotten from the National American Academy of Pediatrics is that they will continue to be offered through Vaccines for Children program, and they also will continue to be offered and paid for by third-party insurance companies.
And Dr. Lacroix, when you're talking with families about about vaccination specifically, what are the things that you really like to personally kind of talk with families about as you think about it from a personal aspect?
Sure. I think that foundations of aspects like vaccines are safe, vaccines are well um, studied, they're documented. The ongoing documentation happens with the vaccine events reporting system, and that urging families that we have been so successful with vaccines that people do not remember or know how devastating so many of these conditions can be. Even grandparents now are aging out, finding people who have seen children struggling with whooping cough. Grandmothers are younger now and haven't seen this, and so helping families understand that preventing these diseases is is such an important part of protecting their children. Just as we encourage them to put them in car seats, this is just another protection that you can give your children, that they don't have to suffer through these diseases, and many of which, measles being a great example, we don't have a treatment for. Treatment is supportive, and supportive often means having to be in the hospital or on ventilators or having excessive IV supports to bring you through this condition. And we have to not forget that even diseases that people commonly experience, like influenza, 200 children died in this country with all the care available to them that is available anywhere in the world, and we still lost 200 children to influenza. So I think the idea around being able to protect your children in a way, in to really be able to ask your questions, share your fears, and have your conversations is really important as a parent to have that conversation with your healthcare provider.
Thank you, Dr. Corey. The question is it possible to receive a brief explainer different on the difference between, for example, a vaccine which helps to subdue or curb symptoms versus a vaccine which provides lifelong immunity or prevents the disease from infecting someone? Do the majority of these vaccines in the full recommendation list or high risk slash shared decision making group fall into either of these categories? And I
That's a
can read
great
over if I need to.
Yeah, no, that's a great question. So, there are some disease processes, like influenza being a great example. It changes. Viruses are probably smarter than us, and they can modify and mutate and change to evolve to avoid being destroyed by the immune system. So, those vaccines are ones that are designed to diminish symptoms, um, and not necessarily have long lasting protective antibody response. Chickenpox, on the other hand, is a vaccine that provides an antibody response. You get a second dose of it, which gives you both a booster and also captures anybody who might not have made the response. And those antibodies persist and are there to go and immediately respond when someone is exposed to someone who has shingles. Shingles is caused by the same virus that causes chickenpox. So if someone has no chickenpox immunity and they're exposed to someone with shingles, they could potentially get chickenpox. So the immune system that has been primed and knows what to do with that virus immediately responds, and therefore that person that's been immunized does not get chickenpox because they were around someone with shingles. So that measles is another great example, with the long-lasting immunity that comes with that vaccine. And again, it's a 2-dose series because, as we learned, just like we started at the first of the conversation talking about, vaccines themselves have evolved and become better over time, and disease processes that previously weren't present have evolved. And we've learned also that the immune system, we know more about the immune system than we've ever known, and we still don't understand it completely, um, to be able to understand exactly how and why we work so well to protect ourselves against infection. But what we've learned is that when we gave one dose of measles vaccine, we didn't get as great a protection. There were a certain percentage, maybe 7% of the people that didn't respond to that first vaccine. But by giving the second vaccine, we captured those people that didn't respond the first time, so that we were up to about a 95% protection rate, even as high as 98 in some studies. So what we've learned is that we often need to really equip ourselves to have those antibodies that persist for a long period of time. And so by using vaccines that do that, we create what's called a herd immunity. Herd immunity means that there are very few susceptible people in a community that can acquire an infection. So that means the risk of a person becoming infected is much lower because there are only a few people that are susceptible. And so that's where the big successes in vaccines have been in years past, when vaccine uptake was very high. We were able to protect people who didn't respond unknowingly. They hadn't had a response, or they had an immune system defect that didn't allow them to respond, and we didn't yet identify that. And that those folks were protected too, because the disease couldn't circulate in their community. So the utilization of long-lasting vaccines is ideal. So obviously that gets a protection, it carries the protection forward, and it provides the largest number of protections for people who either can't receive the vaccine or didn't make an antibody response. The shorter acting vaccines, like influenza, so influenza lasts for about 6 months in providing the antibody protection. We also know that it's a seasonal disease, so the disease itself circulates for about 6 months. The same is true with RSV. This antibody that the babies can receive now, and there's also a vaccine that mothers can receive and actually give their baby the mother's own natural antibody. Those antibodies last again for about 6 months. That coincides with the season of when this particular disease circulates in the community. So that part of it also helps give protection during the highest risk time. And then for children that are, say, premature, have lung conditions, are at high risk to have a bad case of RSV or to require hospitalization for RSV, those infants also get a second dose the next time the season starts. So typically is the start of October is sort of the start of RSV season. So that's the difference between the different vaccines and the length of protection that we expect they may give against these disease processes.
Thank you, Dr. Lacroix. The question is, do you think parents understand the risk of certain childhood diseases, such as measles?
I think that because there hasn't been a lived experience, either with direct family members or people in their community, or that they haven't personally seen the effects of these diseases on children, I think it does make it less severe in their mind. I think that a lot of people believe that medical advances have now allowed us to sustain people through these illnesses, and therefore that not as many people die of these infections as in years past, and that is true. But I think, one child that dies to a vaccine preventable illness is too many. especially when we have the opportunity to protect them.
Yeah. The question is, um, do you think this new regulations, do you think it will reshape how doctors and parents approach childhood immunizations?
No, I think the approach to childhood immunizations has been an evolution for a number of years. The conversations about vaccines have evolved over time with families, and I think that this uh, simply just organized it into um, ways that allow us to discuss with families, um, what do you think your child's risk is for this? And here's what I see as your child's risk for this. So I think it allows us to have a conversation about the vaccine, and for parents to have more clarity. The documents define a lot of cases where situations like meningococcus. Meningococcus, we know, can be a very, very devastating disease. We lost a child to meningococcus in the upstate this year, and I think that being able to have that conversation with the families about what do you see puts your child at risk for this, versus the idea that this is a very safe vaccine. It's a vaccine that can provide immunity to all the different types. Now we have a full scope. In years past, we could not protect against meningococcus B. We now have a vaccine for that, so that we can actually change the course of what people are susceptible to now with the vaccine development. So I think it allows you to have that dialogue, really, to understand what families see, and share your perspective as a physician for how you see this would be beneficial for their child.
Um, what reasons do parents give about why they choose not to vaccinate their child, in your experience?
My experience has been that some of it has been related to people that they've known, or things that they've read, or friends second or third hand whose child had a vaccine related fever, or a febrile seizure, or something that they temporally related to a vaccine as a reason. Sometimes they themselves personally say, um, I have, I get flu-like symptoms every time I take a flu vaccine. Therefore, I don't want to chance my child having that same response. It's often based on those individual experiences, and then some of it is based on the fears that are multifold. When you can help families really unpack what their concerns are, they're based on a number of things. But I think that the majority of the people that I've talked with, it has been related to personal or anecdotal, or people within their community that they have perceived have had a bad outcome with a vaccine.
Okay, so the Department of Public Health is recommending for both flu and measles infections, and they tell us that the rate of those vaccines are fluctuating consistently. Are there concerns from local health providers that vaccines efforts will slow? And then the second part of there, are there potential concerns for short and long-term implications on vaccine pullback that you can touch on?
Yeah. So I think the answer is we have seen, and have been seeing for a number of years, more vaccine hesitancy. That has just been the landscape of many things that began, some of which were truly, truly misrepresentations and factitious claims against vaccines that began this movement. And so we have been seeing this. I think the concern, the fear, and the reality of what we are seeing now is that we are seeing these diseases reemerge. We are seeing pertussis. We are seeing babies with whooping cough, requiring hospitalization and support because they cannot even catch their breath from the coughing. We are seeing measles cases. We are seeing that we are seeing more pneumonias and meningitis that all could have been vaccine preventable. We are seeing chickenpox. Um, we are seeing that um, big groups of children are having to be excluded from school, either from chickenpox or measles um, exposures, because again, um, those people at risk are the ones that you're most concerned. They're not vaccinated, and they are the folks who are likely to acquire these infections. Many of these are respiratorily transmitted, and we know the children don't contain their respiratory secretions very well. They cough and sneeze on each other, and they don't wash their hands very well. And so we know that their risk of transmitting from child to child is significant.
Are there potential concerns for short and long-term implications on this? I guess was make sure you heard that
Sure.
part. Yes, ma'am.
Yeah. So, I think long-term implications, meningitis is devastating. Meningitis can leave children severely, severely impaired. Um, we are fortunate that we lose fewer children to some of these diseases now, but sometimes they are left with lifelong disabilities related to these, whether they're hearing loss or whether they're intellectual disabilities. Certainly, disease processes such as um, secondary infection after um, measles or after varicella or after even influenza can lead children to have some pulmonary compromise that can persist for, and sometimes even permanent damage to their lungs from secondary infections related to some of these disease processes. So I think that there is that long-term health implication, not to even account for cases of encephalitis, where the actual brain itself is affected from some of these viral infections, that truly, again, has a lifelong disability associated with it.
Mhm. I think that's all the questions that we have. I just wanted to give you a chance to wrap up if there's anything in particular that you wanted to just say in general about vaccination in general or anything about this topic.
Sure. I think as history unfolds, we know that vaccines have been one of the most impactful health initiatives ever, um, to become available really to the entire world. And the fact that we have these vaccines that we know are safe, we know that they're effective, they're monitored, and continue to show us good results in preventing childhood illnesses that children were lost to in years past. I think the focus on prevention um, always should lead the conversation with we if we can prevent a car accident, wouldn't we want to do that? Well, we could prevent these disease processes affecting our children, and I think that prevention always is better than hoping for the best and hoping that the level of excessive medical care can bring a child through one of these significant illnesses.
Okay, I got another question right when you finished. While doctors still have the freedom to discuss vaccines with their families, the messaging trend from the CDC seems clear is their concern that the CDC and other federal providers will not be reliable providers of information and guidance. Or, the physicians, I think you talk about the American Academy of Pediatrics, but are the physicians concerned about this?
So I think that the groups that are reviewing the literature, reviewing the science, looking at the science in um, objective ways, are the groups that also can serve to inform parents. So you can go to sources like the American Academy of Pediatrics, you can go to the sources like Infectious Disease Society of America, and the groups that are looking at science for the evidence and the truth that these studies are all done large scale. They are all put through rigorous testing, and being able to look at the science behind those and to help families be able, everything is available to families now on the internet, which is great, but I urge families to look at reliable sources. Healthychildren.org is an incredibly good resource for lots of children's health issues. And being able to go to those sources and always knowing that you can come to your child's provider and ask them those questions. And if they don't have the answer, they're going to find them for you and get back to you on that. And so knowing that that you can really look at these things yourself and really have that open conversation and dialogue with your provider are really important parts to lead in all of your child's health care. Whether you have concerns about their development, whether you have concerns about other parts of their health, being able to go to your provider and have that conversation is incredibly important.